Internationally, are there any areas of the world that have you concerned?
Well, as I said in a previous podcast, I fear that the rest of the world is learning from us, just as we should have learned from the rest of the world earlier in their experience. As we saw in April, May, and June, many other countries in the world really put their foot on the brake and brought their outbreaks to almost screeching halts. Case numbers diminished dramatically. And they were quite successful in driving down numbers far, far below what we did when we got to our 22,000 cases at Memorial Day and said, oh, we're done. Pandemic fatigue, summertime, outdoor parties, and we're going. These other countries in the world, in many cases, actually got the numbers down so low that they were able to use testing, contact tracing, follow-up to maintain low levels. But then they started to open up, and they didn't do it gradually. And as a result of that, they've now seen explosions. We have cases in a number of countries in Europe that are as high now as they were in April. And these were countries that had quite good control going. And people will say to me, well, they never really had control. And I just come back to one shining example in this country, and that's the state of New York and New York City. They have now, just for the last 30 days, been under 1% positives among all their people tested. They are just opening up restaurants again to 25 to 50% capacity. Still, they're not back to where they were, but they have done an incredible job of controlling what they could in terms of this pandemic in the state of New York and New York City. Now, I know I'll hear from people who say, but our life isn't the same. It is not. Please know, I understand that. We all do. But at the same time, you're not seeing these incredible high numbers of cases and deaths. You already went through that in April. You went through a hell of a time, a horrible time. And there were things that anybody in their right mind would recognize would have been better had it not happened that way. But I think the lesson is now. So I still believe we have that ability to get through to time for a vaccine. And I want to be really clear, too, because there's been some misconceptions about vaccines in that they think that they're all going to be there right away once they get licensed. It will take months before we'll have enough vaccine to vaccinate this country. So we're going to be in this for a while yet. As far as other international countries, let me just come back and say that India is poised right now to surpass the United States in total number of cases and deaths. We're seeing really a tragic outcomes in some of the South American countries. So there are other countries out there that are houses on fire that are really a challenge. Other countries are trying to regather their public health control efforts and bring case numbers down. We're seeing that, in France, England, Czech Republic, Spain, and we'll see how well they're able to do. Again, I don't have any hope for us taking the course we are right now that we're going to see these numbers drop much lower. In fact, they're only going to go higher. One last point I want to add, because I keep getting comments about this, and it has to do with Sweden. For the last 10 weeks, Sweden has really had very low numbers of cases, in the 200 range, 300 cases a day average, compared to they were at 1,400 a day at one point. And people are saying, see, look they've actually succeeded. They did hit herd immunity or something they did basically drove the virus transmission down. And, I would like to be so optimistic. I would like to congratulate them, but I know better. This is, to me, just like what happened last spring when California had very limited activity, and there were all kinds of people coming up with reasons why. Lack of public transportation, so people weren't getting exposed that way. The fact that they were all spread out throughout places like LA, et cetera. It wasn't living right on top of each other. And these are all reasons why they were not going to have a problem. And then we saw what happened in July and August. And suddenly that issue of mass transit didn't seem to make a difference, or if it did, it was sure not a positive thing. And so I think Sweden's in the same boat. I hope not. I'll be very, very, very willing to be wrong on this one and acknowledge that. But I think 3 or 4 months from now, I'd like to see where Sweden's at. And I have no reason to believe that they're going to continue where they're at right now. I think they're in a respite. And so please don't use Sweden as the policy answer for how to deal with this pandemic. It's not. And, I'm not going to sit here and tell you one day when cases go back up, it's just more a matter of knowing that anyone who has a simple answer to a complex problem is most often wrong.